Hello. So we are getting ready to go live. Well, getting ready. We are live. Now I just got to add nurses Melissa. Let's see. I wish this was easier. This is such a waste of time. Let's see if she comes. Hey everyone, I'm going to be talking with Melissa from Nurses Know Chemo, and we are going to answer. Oh, well, that
Hi.
was easy.
Cool.
How are you?
Good. How you doing?
Good. So I was just telling everyone we were going to talk all about different side effects, and we were going to talk about mouth sores. So if anyone has any questions, if it has to do with mouth sores, great. If not, just put them in the comments. But I am Stacy. I'm a culinary dietitian, and I wanted to introduce Melissa from Nurses Know Chemo. So why don't you just tell us a little bit about yourself and what you do?
So my name is Melissa. I've been a nurse for actually about 12 years now. But I've been in oncology for 10 out of those 12 years. So really strong focus on oncology. I've worked outpatient oncology, inpatient oncology, and really love educating my patients. So I have also created a company called Nurses Know Chemo Kits, and that is products that actually get sent to patients. So either family or friends can buy them, and sometimes patients buy them themselves. And those kits have products in them to help with side effect management. So it's a little something different instead of like your fluffy socks and blankets type of thing. And they come with education cards. So
Yeah.
yes, oncology nurse, but love educating people. So anytime anybody has a question, we're ready to answer it.
Yeah, and I think it comes in handy because I do see in a lot of like Facebook chats and even on
Yeah.
Instagram, people are saying, my loved one has cancer. What could I do for them? Like, what could I do? And this is a great option. I mean, me with the dietitian, I'm always thinking, oh, you can make meals for them and
Yeah.
freeze it. But also, these kits are fabulous for them because you don't really know what to get someone.
Yeah. And some oncology centers have like a big list, but it can be super overwhelming. You go to your education visit, you get out of there, you just learned about what you're about to go through, and now you have this big list to shop for, and it's usually very generic, like anti-nausea candies. Well, what is that? And what
Right.
does that mean? And which ones work really well? So doing this for 10
Yeah.
years, we picked products that we know work really well for most patients.
Awesome. And whoever's watching, if you have any questions, put it in the comments. We're here to answer your questions, but we figured we would just pick a topic to discuss.
Yeah.
And the mouth sores, I think, is so important, especially with nutrition, because, you get these mouth sores and you don't want to eat. So there are little things that we could do to help with the mouth sores. And I hate talking about foods to avoid, but with mouth sores, there's definitely a list of things that can make it worse and irritate it more. Why are so many people told soy with estrogen positive breast cancer? Isn't that outdated? Yes, it's very outdated. Uh, you can have soy. The only thing I do tell people is not the soy isolates, like in supplements, because it's a lot more than just eating tofu or edamame, but it's perfectly fine to have it. And the research does show that soy is beneficial. So if you do eat soy, you can continue. If you don't like soy, you don't have to eat it, but it is a beneficial product, especially trying to do more plant-based eating. It's a great source of protein versus doing chicken or fish. So yes,
That was a
soy.
really good
Yeah.
question because I hear that question very often. Yeah.
Yeah. And I still have
And
doctors telling people, oh, don't eat soy. Even my oncology, physical therapist. Yeah, it is. Oops. Yeah, it's not true. You can have it if you do eat it. But yeah, it's very outdated information. So I try
the
to
one thing,
educate my doctors
uh,
too and give them research to
yeah,
show.
for sure. That's what I was going to say. One thing to add is just if you're asking somebody a specific question like that, whether it's your physical therapist or your doctor and your oncology nurse, you can ask them, what do you use for reference? Oncology nursing, we usually use NCCN guidelines. And my favorite that I have a lot of books on is ONS, which is Oncology Nursing Society. So you can always ask, what reference do you use, and is it updated? We tend to say things within the past 5 years is to really stay current. But the way that immunotherapy and chemotherapy is changing so much, I try to stick closer to the 2 to 3 years instead of the 5 if I can, to answer most questions like that.
Yeah, and then, I mean, if we're second with the chemotherapy is being infused frequently will prevent mouth sores. I stopped getting them when I sucked on popsicles or ice. I actually. Do you see that?
Oh, go ahead.
No, I'm asking you if you've seen that work. Have you had patients?
Yeah, it does really work. And actually, this book that I have in front of me, which is again by ONS, they have a really, really cool chart about different treatment different treatment options that you can try. Some are pharmaceutical and some are not, but they do talk about cryotherapy in here. So cryotherapy, for anybody that doesn't know, there's a couple different kinds, but the one that we're talking about in this question is using ice chips. So it says the efficiency of cryotherapy consistently reduces the incidence and severity of oral mucositis among patients receiving bolus 5-FU. So patients that are getting Fulfox or Fulfiri, that has the bolus 5-FU in it. So it does actually, evidence is showing that it does decrease it. And they recommend 30 minutes of cryotherapy suggested prior to 5-FU therapy. There's the only thing that I think of as a nurse with the ice chips is some treatments you can't have ice. So it's not recommended for oxaliplatin because that ice can cause other issues. So always touch base with your doctor or your nurse about it, but it's definitely something you can try.
Yeah. And if it works for you, that's great. And she also did the Pedialyte popsicles were great. Yeah, and Pedialyte is great too because it's more hydrating. At least you're getting some of your sodium and your potassium, some of your electrolytes than water, because that was going to be my first thing of saying with mouth sores anyway, was hydration is so important. So even if it is doing the electrolytes, if it's the Pedialyte, any of those brands. Ice chips, I took popsicles. I was going to ask you, honestly, if you did bring the popsicles or did they provide them for you at the cancer center? Because, anyway, I won't get into that, but I was just curious.
Yeah, sometimes it's definitely something to mention if you do plan on doing ice therapy during treatment or you're bringing on in your own stuff. It's definitely something you need to mention beforehand. Like I've worked in an oncology center where we had mostly volunteers that were giving out like drinks and snacks and stuff. And we purposefully had no ice machines because again, there's those chemos that where if somebody gets a drink with ice in it, it can cause some bronchospasms. So trying to figure out how you're going to get the ice or how you're going to bring it in, or do they have a freezer you can use if you bring in your own stuff, is definitely things you need to think about before you just walk into the infusion center.
And she had a question. Her oncology PT asked me where to get the updated info on soy. Can you please repeat that? Melissa, where did you get the updated information about the soy?
I didn't say mine was about the cryotherapy and the mucositis. So I didn't know if you have like a nutrition source for the soy. I don't have one offhand, but we can definitely take a look and post something after.
Yeah. Well, you were saying your book. Like I use the oncology. There's an oncology dietitian book. I can't the name of it, but you were saying the oncology nurses society also.
ONS has some really good resources. So either NCCN guidelines or ONS. NCCN can sometimes I think it's more for medical professionals. But ONS really can simplify things. The book that I really like is it's called Chemotherapy and Immunotherapy. And it has tons of evidence-based research in it. So I only had pulled the mouth source page, but I'm sure there's research you can find in the soy that's current.
Yeah. And after, if you want to put it in the
Sure.
comments, the sources you said.
Yeah.
Now we have a question about what role can integrative medicine have in side effect management? I mean, my biggest thing, the thing I promote all the time, is acupuncture for certain people. I think acupuncture could be very beneficial for people going through treatment if they're having nausea, vomiting. I love acupuncture. I go every week, every other week for it. I do believe in it, but I do see amazing results from people who are going through it. Did you have anything else?
I think acupuncture is awesome. I'm like a big advocate of it too. I even saw somebody who the person that did the acupuncture actually worked on certain areas and it helped with taste changes,
Yes.
which I thought was so cool because typically we're like, you know, there's some things that you can try that might be really sweet or something like that that you can taste better. But I mean, never had I thought of acupuncture for taste changes. That was really cool.
Yeah. Also, I have a friend who is a hypnotist. So she's worked with patients taste changes with hypnosis. And
Wow.
it's worked. Like, she's like, the guy couldn't eat for weeks and months, and he came to her, and I don't know, the things in the brain. I mean, I should do a live with her for her to talk about it, because it was like really cool, because the taste changes is awful for people, you know, and that is you know, it could hinder people's weight and what they eat. Any other integrative medicine? Massage therapy sometimes is very beneficial.
Sure. Reiki. I've seen that help with some peripheral neuropathy issues. Sometimes they can focus just on the feet itself or the lower extremities. Has been really helpful for patients.
Yeah. And I believe all this stuff with the chemo and radiation, not instead of it. I think all this stuff together could help alleviate some of the side effects or help deal with it. Thank you for that question. If you have any more, just put them down. But some cancer centers now are great, where they have integrative medicine departments, where they have the doctors, they have acupuncture, massage therapy, all those things. They have store, like a shop where you could buy bras and wigs. So some cancer centers have really jumped on the bandwagon of it, but I think it's helpful, instead of people looking elsewhere to find professionals to help them. At least these people are certified and
it's really cool. I actually started working at a newer facility the past month, and on Fridays when people come in for treatment, they have a professional masseuse that comes around, and she'll just pop in and ask if they want a massage while they're receiving chemo. It's so awesome.
Yeah.
The patients love it.
Our center does that too. It's great, because I work part-time at a cancer center, so they have that also, which I think is helpful. It helps with the stress, it helps with the anxiety, just to relax. Sometimes the muscles are very tight from sitting in the chair, so to get knots out, all those things be helpful. Any other questions? Well, if not, I'll start going about the mouth sores and go about the hydration, because I think it is so important. So when you drink and you think you drank enough, drink another cup, because we need to stay hydrated. The other thing is, we want to not have the acidic foods. Those foods can make the mouth sores worse. So if it is the tomato sauce, the lemons, the limes, that could really irritate your mouth. And avoiding any of like the crunchy foods or things with things in it. Like, I'm thinking of nuts and seeds, or your peanut butter, like crunchy peanut butter, things that are smooth and soft. So yogurt, mashed potatoes, soup is my favorite, I gotta say, because you can add so much protein and calories to a soup and blend it up, like the immersion blender. That's one of my favorite kitchen tools,
Yeah.
because you can make a really soft, smooth soup with it. Or even if you have a blender, you could do that too. But then you're cleaning another big thing.
Yeah.
And I don't want to clean.
I know one doctor I used to work for ages ago, she would always encourage milkshakes. And so if they ever had any mouth issues, you know, sometimes cold things in your mouth make it feel so much better. So she would have them take a package of Incarnation and then do a big scoop of like 1 or 2 scoops of their favorite ice cream and then whatever source you want, you know, like almond milk or whatever, and blend it up and then just drink the milkshake. And that way they're still getting nutrients. It feels really good because it's nice and cold and it tastes good. It's like win-win. I just always love that. Yeah.
And the same concept is, I tell people that if you like a certain protein shake and you're sick of drinking the shakes, you could buy the mold and make ice pops with it. Not for the people who can't tolerate the cold, but you could take your shake, whatever brand you like, put it in the mold, freeze it, and then you could suck on it. So then it's cold. It helps with the sores. You're getting your calories, you're getting your protein, but even adding the things to the shake. So like, let's say you have a shake, you could always add more calories to it and protein by adding protein powder to it. You could add avocado, banana, what else? The nut butters to it, just to oomph it up a little bit, and then freeze it. And then you don't have to worry about it going bad. Leave it in the freezer and, you know, eat it as you need it.
Yeah, yeah. I love that idea of doing the mold. That's a great idea.
And plus now they have fun molds. I mean, I have a child, so like we bought molds that look like bears. We have ones that look like rings. Like you can make it fun. It doesn't have to be boring, like regular popsicle.
Yeah.
Especially if you have kids with cancer or even adults. Like I like the shapes. I don't want a boring shape. I'm a kid at heart.
For sure.
Question about managing fatigue from chemo or radiation.
Yeah, so from the nursing point, I always, I do find sometimes healthcare professionals are so quick to be like, yeah, that's part of it. But really, I like to do a little bit further assessment. So yeah, unfortunately, it is a side effect that there are things we can do. And I would encourage any healthcare professionals that might be listening to this is to really go a little bit a deeper dive and take that assessment. So, okay, you're fatigued, but are you sleeping at night? How many hours? If you're sleeping during the day, is it inhibiting the sleep at night? So I really do a deep dive into a sleep assessment. Is there any medications? I just had a patient literally 2 days ago, and she was taking a medication that made her really sleepy, but she was taking it around 11 a.m. So then she was getting really tired around like 2 p.m. and then not sleeping well at night because she just took a nap around like 2:33, and she had no idea it was from this med. So we just changed that med to nighttime. Problem solved, right? So sometimes it's not that easy, but definitely take a look and ask your nurses, ask your doctor, is there anything in here that's making me extra fatigued other than just the chemo? It could be your diet. It could be, you know, again, certain medications you're taking or something that's maybe inhibiting your sleep. Like if you have nocturia and you're getting up every 2 hours to go to the bathroom, is there something we can do for that? So that's my first, I would say, kind of assessment from a nursing standpoint, is really evaluating what's going on with the sleep habits. We do know that exercise actually, although it might seem a little tricky at first if you're not used to exercising, but it really does decrease fatigue. So I always recommend for somebody that hasn't been exercising at all, just a small walk. So start little, do like a block around the neighborhood. You know, you can slowly make it bigger or longer as you get used to it, but really exercising can be super helpful and just getting up. And I do always encourage my patients those days where you just don't feel like doing much and you don't want to get up, just if you can, try to push yourself to shower. Like sometimes just showering and getting up and putting on clothes and getting out of your pajamas and then like getting out of the house for 10 minutes can really, really help too.
Yep. I believe in the exercise too. We did a live. If you guys want to go back and check my page, I did a live with JC. He's an exercise physiologist, and we were talking about exercise. And he had, I forgot what he named it. It will hit me. But he was saying just 5 minutes, 10 minutes to walk, and see how you feel. Like 5 minutes, see how you feel. If you are getting even more tired, fine, rest. But if you can continue, do a little bit more because it will help with the fatigue. I know it, because I have clients who tell me all the time, I'm so tired. And I'm like, okay, well, walk. Well, that's just going to make me even more tired. But it doesn't. And trust me, I get it. Sometimes it's just nice to lay on the couch and watch a movie, but we don't want to constantly do that because it will make the fatigue worse. So exercise does help. My first thing that came to my head about fatigue, and I've mentioned it before, is hydration. Making sure you're hydrated, because sometimes you're tired because you're dehydrated. So making sure you're getting the fluids in. If you need to do the electrolyte drinks, doing that. And sometimes, like you said before, it could be the food that you're eating, that you're not eating enough. You're going through treatment. You could be not eating as much if you're having diarrhea or vomiting. Everything's coming out. So we need to make sure that you're getting the nutrients in. So making sure you're getting adequate protein, adequate carbs. I know I said the C word, but it is good. It will help you with energy and fat. So we want to make sure that we're eating a balanced diet. But even if it's small little meals, like it doesn't even have to be meals, snacks, but making sure you're getting the nutrients in. That's why the shakes could come in so handy. You're just drinking it, you don't have to chew, you don't have to swallow. Yeah, well, you do have to swallow, sorry. You're not chewing it, because that burns more energy. So sometimes just the liquids is easier to get down and you're saving your energy. So the shakes are good, the soups are good versus like chewing a piece of meat. That could take a lot more energy.
I also would mention that if there's anybody that gets really, really tired on the day of treatment, or even if it's like the day after or that next morning, they still feel zonked, double check your pre-medications with your doctor. What am I getting IV or through my port, peripherally, whichever route it's going, but what kind of pre-meds am I getting? Because sometimes you can swap out for, the main one I'll just say is diphenhydramine or Benadryl that I'm really talking about. And sometimes, we start you off on your first cycle with 50 of Benadryl, and then second cycle, you tolerated it, so it just kind of carries over into your other cycles. But hey, if you're 8 cycles out and you've always tolerated the drug, can we maybe start reducing that Benadryl from 50 milligrams down to 25 milligrams? If you tolerated that cycle, maybe next cycle we can try 12.5. Talk with your healthcare team, because that could make a huge difference on how you feel after treatment. So if you feel kind of groggy, we call it like Benadryl drunk. If you feel like that the whole rest of the day and the next morning, talk with your providers. Is there something else? Can we switch it to a different med too? Is always another option. So that can be really helpful. I used to have a patient that always fell asleep during treatment because we were giving her Benadryl.
Yep.
She tolerated this treatment for months and months and months. And finally she said, I feel so groggy. And we slowly tapered her down, her Benadryl. And then to the point where she had no Benadryl. And it was so funny because during treatment, she's wide awake reading a book.
Right.
And people are like snoring around her. And she's like, And it's so funny because she used to snore all the time, but she has no idea. And now she's awake for treatment. It always stuck out to me. So yeah, you can definitely start to decrease those meds if you tolerate your treatment well.
Yeah, Benadryl. I've gone to see patients and they had no idea. I went to see them. You can't wake them up. They are so out. But yeah, but also you brought up a good point about talking to your healthcare team, like making sure your doctor knows like what's going on, if you are fatigued. And I do hate the response to, oh, well, it's part of treatment. No, like that's not an answer.
Right.
We should accept that, there are things that we could do to try to help alleviate it, but just to say, oh, well, that's the way it is. No, it doesn't have to be.
Yeah, definitely.
Any other questions? We could put it down. But back to the mouth. We'll keep going back to the mouth. One thing I wanted to say is that you could do rinses. So like salt and water rinse, or some people like to do the coconut oil to pull. So they put the coconut oil in their mouth, they leave it for 5-10 minutes. Some even do, I know my integrative medicine tells people to leave it in like for 20 to 30 minutes. I haven't tried that. That seems like a long time. My husband and my son would probably like it because I can't talk, but those are other options that you could do.
That's really cool. I haven't heard of that one with the coconut
Yeah,
oil. Awesome.
it's called oil pulling.
Okay.
So yeah, and it's
Cool.
easy. People have it in their house, but you just take a spoonful of it and leave it in your mouth and swish it around. But
Cool.
also soda and water, add a
Yeah.
little salt, right? Any other recipes for that you have?
Yeah. Yeah, I mean, usually prophylactically, almost every place I've worked, as far as oncology goes, it's 1 to 2 tablespoons of baking soda, 1 to 2 tablespoons of salt, and 6 to 8 ounces of water. Sometimes people batch it so they can just pour it out. And also important to remember when to do those things. So it's not just like your typical oral routine where you do it in the morning and at night. It really, really helps to do it after meals is the biggie. So this isn't just like a 1 or 2 times a day thing. It's the more you do it, the more helpful it usually is. But after meals is a big one.
Yeah.
As far as like if you do have mouth sores, they do tend to spread quite quickly, and then at that point it's a phone call. Like as soon as you get 1 or 2 mouth sores, you really need to call your oncology center and make sure that you're following whatever protocol they do. You don't want to wait because these things spread fast and spread quick, and if you do wait until your treatment day where you're seeing your provider, I'll tell you your treatment's probably going to be on hold if you have a ton of mouth sores. So we usually, with a phone call, sometimes we'll bring somebody in and take a peek. A lot of times it's a prescription of what we call magic mouthwash. There's so many different recipes of magic mouthwash, but the one that I'm most familiar with, it's 3 equal parts of dexamethasone, Maalox, and lidocaine. And some pharmacies will just mix it for you, and you just pick up the script and rinse with that. I was reading, however, in the ONS book that there's mixed studies about the magic mouthwash. It says data demonstrating efficiency are lacking for the prevention and treatment of mouth sores with the magic mouthwash. I find it seems pretty helpful for patients. It maybe not clearing it up specifically, but maybe comfort wise. But yeah, I did find that really interesting in the book.
Yeah. I mean, if it works for someone and it's working for you, hey, why not?
Yeah.
You know? But the mouthwash is easy to do. So do you recommend people do it before they, I know you said after, but should they do it before they eat too, or just after?
Yeah, it definitely wouldn't hurt to do it before and after. Yeah. Usually we say after, but hey, it's not going to hurt to do it. The more you do it, the better.
Yeah. And plus the salt and I guess the baking soda helps clean it out so it doesn't get infected.
Yeah.
So
Yeah. Yeah, the baking soda is key in there. It helps with the pH balance of your mouth with that baking soda in there. So that can be super, super helpful.
yeah.
Um, and the main thing is to avoid alcohol rinses. So I'm not just talking about drinking alcohol, but sometimes these mouthwashes like Listerine and those over-the-counter mouthwashes can have alcohol in them, and that's actually going to make your mouth sores worse. So make sure they actually do have a Listerine that's non-alcohol based. Not that I'm recommending to really take that for mouth sores, but make sure whatever product you're using that does not have alcohol in it, because that's going to further dry up your tissues.
Yeah, I think the salt and the baking soda is so usually things you have in the house anyway. So save your money on buying some of those mouthwashes, but read the label. Like anything, read the label, make sure it doesn't have alcohol in it. And like you said, don't drink alcohol either because that will irritate it. And if we're talking about too, avoiding any of your bubbly drinks. So sparkling water, soda, ginger ale, things like that could make mouth sores worse. So stick with the flat water. You could flavor up water, but none of the bubbly stuff.
Ooh, that was a good thing to mention because I do have a lot of patients that love the bubbly,
Yeah.
waters, and that's a good point.
They all have their place. Like, it is
Yeah.
good. Or, you like soda, having, sparkling water is a great alternative to cut the calories. But with the mouth sores, not too much.
Sure. Yeah.
Even doing probiotics could help. So I'm not talking about taking supplements of it, but having yogurt or kefir, things like that, just to get some good bacteria back in your system and clean out the mouth sores will help. And plus, it's cold. And if you were having the issues with the cold, doing it more at room temperature. Some people like yogurt at room temperature, so you could do it that way too, so it's not as cold.
Yeah, great tip. I like that one.
I like yogurt. I think it is beneficial. There's so much protein in it, especially if you're getting the Greek yogurt. It has a lot more protein in it. So, and plus, for some people who don't want to do dairy, they have great non-dairy alternative yogurt. So
For sure.
everybody could have yogurt.
Yeah.
And the good bacteria is in it. So yeah, I'd rather people get it through food, the bacteria, versus supplements. So having the yogurt, the sauerkraut, kefir, things like that have good bacteria.
Absolutely.
And if you're a oatmeal fan, that's easy to have. So you could flavor it up. It's soft, easy to get down. You could always add protein to it. You could add your nut butters to it just to oomph it up a little bit. But I love oatmeal as a snack or, a breakfast item for people to have that's easy to get down.
Ooh, yeah. Overnight oats.
Yeah.
I love.
Yeah. So, is there anything else you wanted to bring up about the mouth sores? Because we're at a half hour, so I don't want to.
No, I think that's it does really go fast. I think that's the biggie is, these tend to move quickly throughout your mouth. If you have one pop up, if you don't take care of it right away, it's going to spread fast. So really knowing that this can delay your treatment, and get on the phone if you're not sure what to do. Get on the phone, call the oncology center, get a prescription, or schedule a visit, and don't wait on it, because mouth sores are really serious. If really bad, they can you can get hospitalized with just really, really poor mouth sores, because it inhibits, eating and everything. So take care of it as soon as you can is my biggest suggestion.
Yeah. Keeping in touch with your oncologist, if you have a navigator or a nurse, whoever, just keeping in touch with them, letting them know what's going on, I think it's important, but yeah, so keep on top of it. You don't want to let it go for a long time, because like you said, it leads to other things. Fine, you have mouth sores, but now you're not eating, you're not drinking, you're getting dehydrated, you're losing weight. Like, it's a vicious cycle. So we need to stop it
Absolutely.
at the beginning, prevent it from, getting worse.
Yeah.
So how could people find you? Where are you on this social media world?
Yeah, so we do a lot through Instagram. We're on Facebook as well. So we're Nurses Know Chemo Kits. And then we have a website, which is www.nursesknowchemokits.com. And from there, you can order kits. We can send them to you, and you can give them to somebody, or we can go ahead and send them right to somebody that you want. So you don't have to be that middleman. It's a flat rate shipping, so it's not anything too exorbitant as far as the cost goes. It's about the same cost as a flower delivery. And we have all different kits. We have chemo kits, radiation kits, and I'm just coming out with a last day chemo kit. So just something fun to celebrate. I have one of the mugs here that comes in the kit right here, and it says, "Enjoy the gift of an ordinary day." So it's just a smaller kit, a couple items in there, but that's to give somebody on their last day of chemo. And we're always looking to get new products in, and hopefully we'll keep enhancing our kits and come up with different kits. But for now, it's chemo, radiation, and the last day chemo kit available. And you can always donate a kit too. So if you want to, usually it's people that have been through treatment themselves. You can just hit the donate button and you can go ahead and donate the kit. And what that means is me or one of the other nurses that works for us will donate a kit within 2 weeks to a newly diagnosed cancer patient. And these kits are for male or female, so it's not specific to a certain type of cancer or your gender. It doesn't matter.
Awesome. And yeah, so follow them.
Thanks.
Go up. Everyone just go up. I don't know where we could see her, but follow Nurses Know Chemo. You can find me here on my Instagram page. I also have a bunch of freebies of different recipes that you guys could download. I have a Facebook group, but I love helping people. So yeah, follow us. And I'm starting a podcast. So if you are a cancer thriver, I'd love to interview just to share your story. So you could DM me and tell me you're interested, and I'll send you an application. But thank you. This was so much fun. I know we've done before, but we need to do this more often.
Yeah, I love it.
If any questions, just DM us. We're here to help you and support you. So thank you guys for watching, and we will see you soon.
Have a good night. Bye-bye.